Hi, my name is Jordan Taylor, and this is Shakayla Smith.
And we will be presenting a case study to you on today entitled What's That Cost? Hope you enjoy. Case study scenario stage 1. What's causing that cough? A mother frantically enters the ED clutching a lethargic young boy. The mother states, he just won't eat and he's burning up. He has not eaten in days. All he wants to do is cry. I don't know what else to do. The baby is immediately taken to the back to be triaged. An intervention here would be to raise the head of the bed to promote drainage as well as increase ventilation and to monitor the baby for signs and symptoms of respiratory distress. Upon assessment, note the vital signs and different assessment cues that will give you a clue or indicate what exactly is going on with this patient. Take a look.
Let's take a look at the history of this patient. He's a 13-month-old male, born prematurely, and doesn't have any allergies. He has a history of mitral valve prolapse with aortic regurgitation, asthma, and has been to the ER several times in the last 6 months with the same symptoms he's experiencing now: high fever, cough, decreased appetite, and irritability. Note the history of the two parents and try and see how this will be pertinent in diagnosing this patient.
Alright, so now we see that the patient is experiencing difficulty breathing, thick runny nasal discharge, recurrent fever of 102.5, persistent cough, loss of appetite. He's also refusing his bottle. Severe signs of dehydration are also noted. Any ideas of what this disease process may be? So you guessed it, it's bronchiolitis, which is characterized by a fever, nasal discharge, and a dry, wheezy cough. Crackles or high-pitched wheezing may be noted in the lungs upon auscultation. This mainly affects children under 2 years old that were born prematurely and also have respiratory insufficiency. Look at the pathogens that cause it. Also noted is acute inflammatory of the nasal and air passageways, increased mucus production, Risk factors also noted, again, premature infants, attending daycare, exposure to smoking, etc.
Okay, now let's do some thinking. What is the priority to do next with the patient's initial presentation? We want to carefully monitor the patient's clinical status, which includes maintaining the airway and maintaining adequate hydration. Question 2. What are some aspects of the patient's history that may be a part of the pathophysiology of his condition? This would include his premature birth, underlying heart condition, in utero exposure to tobacco smoke, and his low socioeconomic status. Now let's note what the initial physician's orders would be in this situation. Note that we're doing hydration, lab work, vitals, and nebulizer treatments to maintain a patent airway.
Case study scenario stage 2. Now what? After initiating ER orders, the baby is quietly sleeping in room with mother. Head of the bed is elevated at 30 degrees. We note upon assessment that his breathing is non-labored, but his lungs still are a little bit groggy. Alright, so his temperature has decreased, we did note that, and lab results are still pending. Interventions here would be to identify educational preferences of the parent and learning styles to be able to effectively teach, and also pay attention to suctioning.
Now let's take a look at the admission orders for this patient. We're going to continue to monitor the patient's airway and also will hydrate and monitor for signs of fluid overload. We're adding some drugs like Tylenol to help with his fever and nebulizer treatments, again to help with his breathing. If the patient's unable to take food by mouth, we'll insert an NG tube if necessary. Okay, now let's do some more thinking. Number 1, how would you evaluate the effectiveness of the breathing treatments given to the patient? Assess the respiratory rate, the airway, and the oxygenation status. Number 2, after evaluating the educational preference / learning style of the parent, What is the most important teaching topic? Review preventative measures, sanitary practices, and also help the mother to identify environmental risk factors.
Case study scenario stage 3. The baby is showing signs of adequate hydration. We're seeing an improvement in electrolytes, no signs of respiratory distress, breathing is non-labored. After several teaching sessions and going over brochures with the mother of the patient, she states, I thought that if I smoked outside, that I would not hurt him. I would never do anything to cause my children harm. Explain to the mother that smoking lingers on hair, clothing, breath, etc., and teach her the proper sanitary practices to implement after smoking.
Okay, last time. What are some nursing interventions to ensure the patient is not readmitted for the current diagnosis once discharged? Look at the social home and ensure the patient has adequate resources and family education. And also we want to follow up. Make an appointment with primary care providers and other specialists as needed. Number 2, it is recommended that the family be educated on the following topics regarding the care of a child with bronchiolitis. Call the primary care and note symptoms that you would need to call the physician about. Also, we want to explain the basic pathophysiology so that this can be prevented in the future. Thanks for watching our case study. We hope that you really enjoyed it and learned some interesting things.
In the meanwhile, you guys have a happy and safe holiday. We wish you guys all the best. It was a pleasure meeting each and every one of you, and we hope you enjoyed this case study.
Bye.